Hey everyone, today is July the 30th, and thought I'd go ahead and make my next update video since I've hit a couple of goals and had a few things happen in the last about 6 weeks since the last video I made. So starting right off the bat, my weight today is 226.6, which is what made me really want to sit down and finally do the video, because that was the next weight goal, which was seemed kind of like an arbitrary number. It was getting to the weight of 227, which was the weight that I was at about 10 years ago when I got home from the hospital after having my gallbladder surgery, my cholecystectomy. That number is significant because that's the lowest weight that I've been as an adult. So 227. This morning was 226.6. So that's another thing that we get to cross off of the goal list, is right here. But I'll cross that out later. But 227 weight after gallbladder surgery. So finally hit that, and so it was time to sit down and do the video. So that makes a total of about 86.5 pounds that I've lost since the surgery, about 96.5 that I've lost since starting the process, starting with my starting weight in September of 2012 before doing all my pre-op weight loss visits. I had to lose about 8 or 9 pounds or something in order for them to do surgery. So I was 323 at that first appointment, and then I was 313 at my pre-op. So it's just a difference of about 10 pounds. But I usually go based off of my pre-op weight appointment to my current weight, which 86.4 points. So started in a size 26, and I'm now in a size 16 or 18, depending on where we shop. I bought a pair of jeans from Lane Bryant that were a 16, and they fit. I'm sorry, not Lane Bryant, Old Navy. And they fit, and I wore them all day yesterday, and they fit great, and they're not like cutting me off or muffin top or anything like that. I also did try on stuff at Lane Bryant that was 16. So that's why that was in my head. But I'm a 16, 18, a large, extra large. I've been doing a lot of shopping, which is not good. You know, I don't want to kind of spend all that money, but I've been able to go to places like Ann Taylor, Loft, and New York and Company, and Tommy Hilfiger, and go in and pull stuff and try it on and have it fit and be like something that I can wear now, and not something where I'd have to say, well, I'll buy it, and then when I lose 10 pounds I'll be able to wear it. So but I bought some stuff from New York and Company and from Loft that for this coming up school year, so I have work clothes. Because everything I've bought so far this summer has been summertime clothing and won't really be very work appropriate. So one of the other really big goals, non-scale victories that I hit recently, Steven and I took our little vacation out to California and Nevada to see our family and to go to Yosemite. And so the big victory there was I didn't need the seatbelt extender on the airplane, and I had room to spare in the seat, and it was fantastic. I could put the tray table down without it hitting me in the stomach, and so that was one of the big things I finally got to cross off of that list as well. And I'm just looking at my list right now to see if I've done anything else. One of the goals on here was not needing necklace extenders when I wear necklaces, and being able to use regular towels, regular size towels. The necklace extender thing I've pretty much hit. Some things are still a little too tight and they look weird, but I can get them closed, whereas before I couldn't even get them closed. The hotel bathroom towels, I think those are smaller than a standard size bath towel, so those don't quite fit, but regular size bath towels pretty much fit now. And I sat in the hotel bathtub, and I took a bath when we went to Yosemite, and I was really sore, so I soaked in a nice hot bath, and I could fit inside the bathtub, which I could do before, but my hips were hitting the sides and it was uncomfortable, and this time I could actually sit in the bathtub without touching the sides. So that was another thing that I was able to do. I had to have my engagement ring resized, and that was another big deal for me. When we got engaged, Stephen bought me the ring, and it was an 8.5. And it was a little bit tight, but it fit. I could get it on. I could get it off with a little bit of help. Between getting engaged and getting married, I put on a lot of weight, and after we got married, I had to have the ring sized up to a 9.5 from an 8.5. and we have the protection plan for the ring covers resizing for life, but you can only do up to 2 sizes at a time. So I went ahead and decided to have them resize it just for the time being so that it would fit. And they measured it at a 9.5, and they measured my finger at an 8. So I got my ring brought down to an 8 from a 9.5. So that's a big deal, and in another couple of months I'll have to take it back in, and I don't know how small my finger will actually end up getting, but maybe a 7, you know, one can only hope. Anyway, there has been one negative thing that has happened. 2 weeks ago, I woke up at about 2 o'clock in the morning, quarter to 2 in the morning, with this really severe, excruciating pain on my right side near my back. And I'm not one that rushes to the emergency room for things, but after about an hour of the pain not going away, I decided, okay, it's time to go to the ER. And I was thinking maybe it's appendicitis, or maybe I've got a kidney infection, or maybe there's a bowel obstruction or something that's surgery related going on. So we went into the ER at about 3:30 in the morning, and after finally getting pain medication and CT scan, they found that I had a small kidney stone on the right side. So I've been spending the last 2 weeks looking for that, trying to pass it. I'm still not sure that I've passed it. I thought I did because I hadn't felt any pain or had any discomfort for about a week and a half after it all happened. And when I left the ER, they gave me lots of fun medicine and stuff to take to help me pass it. And I was sore for a couple of days, and then I felt better, so I didn't think anything of it for a little while. But then yesterday, excuse me, I'm about to sneeze. Yesterday, I started feeling some back pain again, and it was lower than it was before, but it was on that same side. So I'm starting to wonder if it's moving again. And since it's been 2 weeks and it hasn't passed yet, they told me, the ER doctor told me that I should go see this urologist. So I made an appointment to go do that tomorrow. So hopefully it's on its way out and it's getting ready to get out, because it's really uncomfortable. But I want to get that taken care of before the school year starts again, because I only have about 2 more weeks of vacation before going back to work. And I know you're all crying for me. Oh, you poor thing, you get the whole summer off. But that was really it. I've seen a lot of my friends lately, and I've been really just really pleased by everybody's reactions to how I look, because some of them are people that I don't see but every couple of months. So it's always nice to see the look in their eyes when they see you and like, oh my god. I have a friend who said, Julie, where's the rest of you? So that always feels really good. I like hearing that. But my husband calls me a narcissist, which, you know, it's true. But otherwise I probably wouldn't be putting videos on the internet. Look at me, look at me. Anyway, that's really it for now, I think. And I don't really have any new pictures or anything to post, so just a short little update. Weight's doing good. Diabetes and everything is still under control, or, you know, remission, or resolved, or however you want to say it. Even on the days where I do go a little carb heavy. I had some Vietnamese food last week, and I ate a lot of noodles, and my blood sugar was still completely normal. So still not having to take any medicine for that. And other than the kidney stone, I've still have not had any complications, knocking on wood there. So I guess next time, hopefully I'll have more exciting things to talk about, but exciting in a good way, not exciting like, oh, I had to have surgery because of my kidney stones. So I will see you later, or whatever. Bye.